The World Health Organization's newly released analysis of global antibiotic use, based on 2022 data, presents an alarming and deeply concerning picture of how antimicrobial resistance, AMR, is continuing to grow unchecked in many parts of the world due to systemic overuse of antibiotics, especially the types most likely to fuel drug resistance. Drawing on the Global Antimicrobial Resistance and Use Surveillance System, GLASS, and the WHO Access, Watch, Reserve Aware framework, the report reveals that despite international commitments and mounting scientific warnings, misuse of antibiotics remains rampant, and efforts to curb it are falling short on a global scale. At the heart of the report is a critical classification. Access antibiotics are designed to be first-line defenses against common infections, preferred for their lower risk of contributing to AMR. Watch antibiotics, with broader spectrums and higher resistance risk, should be reserved for more serious cases. Reserve antibiotics, used as a last resort against multi-drug-resistant infections, should be preserved as tightly as possible. However, these distinctions are being ignored or misunderstood in practice. While global guidelines call for at least 70% of antibiotic use to fall within the safer access category, only 1 in 3 reporting countries, territories, and areas, CTAs, meets this target. This means 2/3 of participating regions are failing to follow the most basic stewardship protocols, despite clear evidence that the misuse of broader spectrum drugs is accelerating resistance across bacterial strains. The numbers are stark. In 2022, a median of 18 out of every 1,000 people globally received an antibiotic every day. That might not sound catastrophic until one considers the variation between countries. Antibiotic use differs by a factor of 10 between the lowest and highest consumers. This discrepancy not only reflects irresponsible overprescription in high-use areas, where drugs are often handed out with little diagnostic rigor, but also indicates dangerous underaccess in low-use regions, where even essential treatments may be out of reach. This dual crisis, overuse in some places, lack of access in others, highlights how antibiotic stewardship is not just about reducing consumption, but also ensuring appropriate, equitable access. The overuse of watch antibiotics is of particular concern. These are the very drugs that should be handled with the greatest caution, yet they are being used far too often in contexts where safer alternatives would suffice, or where no antibiotics are necessary at all. Misdiagnosis, lack of diagnostic tools, patient pressure, and pharmaceutical marketing continue to drive this trend. Inappropriate use not only weakens the efficacy of the drugs themselves, but creates ideal conditions for resistant strains of bacteria to flourish and spread. AMR is not a theoretical threat. It is already responsible for millions of deaths worldwide, and, if current trends continue, could become the leading cause of death globally within a few decades. Reserve antibiotics, which should be carefully guarded for only the most resistant cases, are reportedly underused in low and middle-income CTAs, not because of responsible stewardship, but due to availability issues. These are life-saving medicines in critical care, and their scarcity in resource-limited settings could lead to preventable deaths from infections that wealthier countries would have a better chance of treating. This underlines the broader inequity at the heart of the AMR crisis, a global health emergency that affects all nations but punishes the poorest the hardest. While the WHO outlines a few forward-looking measures, support for national surveillance systems, online courses, collaborations with physician groups, and frameworks to improve antibiotic availability, the scale of the challenge far exceeds these steps. Surveillance, while essential, cannot substitute for enforcement, regulation, and cultural change. National policies often lack teeth, and in many places, antibiotics can still be purchased over the counter without a prescription. Moreover, without sustained funding and commitment, efforts to expand education and stewardship risk becoming performative exercises rather than transformative initiatives. The bottom line is that the world is not moving fast enough to stop this slow-motion catastrophe of antimicrobial resistance. Misuse of antibiotics remains widespread. Data collection remains patchy and uneven, and the social, medical, and economic systems required to support stewardship remain fragile. AMR is not merely a health issue. It is a crisis of governance, equity, and foresight. Without aggressive and coordinated global action, the medicines we take for granted today may become useless tomorrow, leaving society exposed to once manageable infections that could again become lethal. Are we prepared to face a future where a simple cut or minor infection can lead to death? Not because of medical ignorance, but because of systemic negligence and resistance born from our own misuse of life-saving drugs?